Hi guys, this is Dr. Bhupesh once again from Dr. BKM Institutes. Please subscribe our channel if you have not and contact us on 76967342256 for the best OET coaching. Once again, this is Dr. Bhupesh from Dr. BKM Institutes. So today we are here to discuss about how to practice OET listening, because these days what we have seen lately that people are performing good in writing and speaking modules, especially when they are practicing it really hard, watching our videos. And the people who are not taking coaching from Dr. BKM Institutes directly, but following our YouTube channel, they have performed really well when it comes to writing and speaking, because that is normally I record writing and speaking just because it is comparatively easy and I can put everybody on mute. Whereas when it comes to OET listening and reading, it is little difficult because I want you guys to participate. So that is why I do not record those sessions much. But today I'm going to record another session of listening, and listening and reading are directly connected. Please understand this most important thing. If you have a better reading, obviously you will have better listening. If you have better listening, you will have better reading. Why? Because what happens in reading MCQs, if you will realize, first of all, you read the question. So you read the question, then you listen the information, and then you try to find the right option. The same thing happens in reading. You read the question, you get the information not by listening, but by reading. So the process is same. You are reading the question, getting the information, and then you are relating it to the option. So rest of the process is pretty much the same, whether it is reading or whether it is listening. So if one of these will improve, the other will automatically improve. So if you are practicing reading part C nicely, that will have direct impact on your OET listening part C, because you would be able to analyze which option is correct. Again, question, listening, then executing the right option. Again, question, reading, relating with the right option. It's exactly the same technique. So today we are just going to discuss some listening class, as you guys have told me that we can take it random. So I'm just gonna put it OET listening. So you can practice as many as listening. Suppose by chance if you are not getting material from us on the email, but you want to practice listening, it's very basic. You go OET, you type OET listening sample, and OET, whether it is a sample for nurses, whether it is physiotherapists, whether it is for doctors, it's going to be the same. So you can open any random listening and you can start practicing from anywhere. Like it does not matter. Like the first thing I'm getting this. So I can scroll down to get as many videos as I want, and then I can open any of the listenings. So generally taking, I don't know which listening should I take now, but I'm just gonna pick one. So if I pick this one, let's see if it is good or bad. Yeah. So in the listening part A,
Second to
in
look
the
at the
listening part A, what's gonna happen is that first of all, you're going to get 90 seconds to see what kind of questions are given. So the most basic fundamental while executing a listening exam is to read the information. So you read the information already. So you will get 90 seconds. So try to understand what is my topic, whether the questions would be of symptoms, whether the questions would be of treatment. This will help you. So first of all, I'm just reading Stephanie, chief complaint battling, duration of symptoms, affect, diet, exercise, smoking, drinking. So smoking, I know whether it would be regular, occasional, or whatever the word. So I can predict the words. It can be regular, it can be chronic, something like this will happen. There would be some chief complaint regarding battling of some disease. Then symptoms, reports no pain, reports no change in dash as well. So there would be no change in one of the symptoms. Dash is frequent and large, dash, then decreased grandmother, deceased grandmother died, dash from Ireland. So most probably some disease or maybe the year will come. Then you will talk about reported abdominal issues. So you can understand the topic. So next step, basically investigation will involve white blood cell count. Then the second thing, level. So some kind of a level. So most probably when we are talking about infections, it might be eosinophil. Eosinophil might be. So I just try to find whatever can be there. Then low levels may cause DASH, tiredness, platelet level, based on family history and symptoms, possible disease, this and that. So basically, I can understand that this topic is more of to find a disease. So the patient will, in the last, we will say possibly you are having this disease. So now you know about the topic a little. Now you will focus on the listening session. So I'm just going to play this listening for you.
You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers.
So in the OET listening, you will get only 2 minutes. So please don't get dependent upon the after things. Like in IELTS, people get 10 minutes, but in OET, we do not get that extra minutes to revise things. So please do not wait. Please try to practice. It is very important thing that I'm telling you again. Please write it in flow. You don't have to write the capital words, but write it very nicely. Some people might be losing marks because their writing is not good. So please make sure that your writing should be readable. Please. And spelling mistakes are important. Only one kind of spelling mistakes are not important, which are based on diseases. Like if I talk about Addison's disease, if I talk about Crohn's disease, so any disease, when on the name of some person like Addison, Crohn's, Alzheimer's, these spellings can be mistaken, but otherwise spelling mistakes are not allowed. The same applies to drugs as well, that only the drugs with the brand name, Panadol, Meftelspaz, means mefenamic acid cannot be wrong. Paracetamol you cannot write wrong, but brand names you can do wrong in the spelling part only. But write it very nicely, write it very clearly. So spelling mistakes should not be there. Spelling mistakes are allowed only for the brand names of the drugs and disease names when it is on the person's name. Only in these two cases. Otherwise, spelling needs to be correct. It should be nicely written. And now I will do this listening for you.
Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
So it says only 30 seconds, but I think the time should be more. But if it is 30 seconds also, then I will read the whole thing, that it is about Stephanie talking about this thing, background, diet, exercise, recent symptoms, and there would be family history, next steps, possible diagnosis, and possible disease. So now I'm just going to take the recording ahead so that we do not waste time. I'm just going to play it.
Okay, so I see that you made the appointment today because of an ongoing problem. Why don't you tell me more about it?
Yes, I have been feeling a lot of fatigue over the last 6 months or so. At first, I brushed it off. I mean, after all, I am an infant school teacher, and most of my colleagues complain of feeling tired at the end of many days.
So what got you to the point of coming in for an appointment?
I have been spending a lot of my spare time taking classes at my local gym, but recently I've been coming up with reasons not to go to them. After skipping them 3 days in a row, I decided that I needed to do something.
And do you smoke or drink regularly?
I never smoke.
So basically, the only thing I could find was fatigue word. So basically, I am not sure about this answer because that has gone very fast. But I think fatigue is the only thing, because in the start, she said that I am having problems with the fatigue. So I'm just going to play it again just to make sure. And then we will go with the flow.
Hello, Stephanie. How are we today?
Doing okay, I suppose.
Okay, so I see that you made the appointment today because of an ongoing problem. Why don't you tell me more about it?
Yes, I have been feeling a lot of fatigue over the last 6 months or so.
Last few months, maybe it has been replaced by last few months. And fatigue is the word that is for tiredness, F-A-T-I-G-U-E. That should be the answer. But let's see, because tiredness is another word she has spoken.
At first, I brushed it off. I mean, after all, I am an infant school teacher, and most of my colleagues complain of feeling tired at the end of many days.
So what got you to the point of coming in for an appointment?
So I was expecting the answer should be here. So what made you come to this thing? So that should be my chief complaint. But she did not speak anything. That's why I had to pick fatigue. Otherwise, the second thing she would talk about would be tiredness. So I will learn from this listening at the end of the day. Otherwise, answer should be fatigue. But this, when he changed the things by saying what brought you today. So that is where my answer seems to shift. So I will listen to it again.
And spending a lot of my spare time taking classes at my local gym, but recently I've been coming up with reasons not to go to them. After skipping them 3 days in a row, I decided that I needed to do something.
And do you smoke or drink regularly?
So basically, fatigue is the only word she has spoken. Also, it is very important to understand that we need to know the chief complaint, and chief complaint is always told by the patient. So the answer should be fatigue as per me, but we will check it out later on. Again, keep your focus high, keep learning. The main thing is to learn. So don't try to go for answers. Try to have some patience, try to control your nerves, and try to listen to it again before you check the answer. So my recommendation is to do listening 2 times before checking the answer. Always do listening 2 times before checking the answer. You will learn lot of things, because once you check the answer, this mind stops working. So your listening goes into waste. If you really want to practice listening, do it 2 times without checking the answer. Then you will be able to learn more.
I never smoke. How disgusting.
So a non
Smoking, so does not smoke. That can be the answer. Smoking, exercise regular. Smoking, not applicable. But again, we will write does not smoke, because this is the exact word she has spoken, does not smoke.
smoker. Got it.
I sometimes have a drink, like at a party, but only once a week or so. Also, I don't know if this is important, but I have been mostly vegetarian for the last 5 years.
So this fill in the blanks, this is the only fill in the blank I can do with confidence. So these are the things that can happen in the exam that can create lot of anxiety, because you don't know, you're not sure about your answer. But don't panic. Just do what you can do the best with your exam. I told you yesterday that there are no specific marks. So if I have felt fatigue over here, so most of the people would have done the same. So in OET, there are no specific marks, means it is not necessary that only 32 marks, the person who is getting 32 marks will pass. This is the most important thing again, so that you can be at calm. That's okay. Whatever I could do, I have done my best. Smoking, does not smoke. Diet, vegetarian. But this is the only answer I am sure about. Third, that is vegetarian. Apart from that, I am also, even the best of the people will not be sure. So do not lose your confidence thinking maybe other would have done. In OET, there are no specific marks. If the exam is difficult, maybe the person who is getting 28 or 30 will pass. So please keep yourself calm and composed. Okay, going ahead.
I do often eat fish though.
So let's start to get to the bottom of this. Other than the fatigue, have you been experiencing any other symptoms?
Nothing that I can think of. What type of symptom?
Like abdominal pain or a change in appetite?
No.
So the second word is also sure, appetite. Now it comes to the spelling of appetite. So that is why it is important to practice one listening 2 times, but at the same time, please practice listening, lot of listenings, so that your vocabulary range can be more. So appetite should be APPETITET, TITE. But again, sometimes I might get confused. I feel like appetite should be 1P or 2P. So that can create hindrance. So please practice as many listenings as you can, but one listening 2 times, and practice like whole lot of listenings you can. So that will help you. Okay, going ahead. So appetite.
Nothing like that. I do sometimes have some issues in the bathroom, like I have a bowel movement like 3 times a day, and I don't.
So bowel movement 3 times a day. That means frequent, means on frequent basis means more often. So that is what she is saying. Bowel movement is something that I go 3 times a day. So I will try to listen it again. Bowel movements. So these spellings should be right. So please practice. Please practice.
What type of symptom?
Like abdominal pain or a change in appetite?
No, nothing like that. I do sometimes have some issues in the bathroom, like I have a bowel movement like 3 times a day, and I don't know if that is normal. Also, sometimes it can be difficult to flush everything down, Is that normal?
Frequent and large bowel movements. That does point to something that could be important. It appears
Now, bowel movements. If by chance you are unable to understand the patient's accent, you can still listen that the other person or the doctor is also repeating. So don't worry, don't worry. Just keep yourself calm and composed. Again, the most important thing, and this is the first module that you get in the exam. So this is very important that you should be very firm. So again, each and everything that I'm telling you is very, very important, because that is what I have learned after 11 years of experience, that while you go for your exam, some people will tell you, please be at calm and do not do anything, do not talk to anyone. But I will say, please listen to something in English before you go for your exam, because that will do your warm up in English. Listen to something in English before you go. Do not attempt question, but listen to something so that your mind becomes conscious. Do not go completely blank in the exam. Listen to something, just like maybe one paragraph of listening, this much of listening, what we have done until now, it will charge you up for your day. So it is very important before you take these small things are 10-20 points. The whole struggle to pass OET exam or any other exam is 10-20 points. You would have listened to many people saying, oh yeah, I would have passed, it's just about 2 marks. Not only in OET, in everything in the world. I just lost by 2 marks. I just lost by 3 marks. I lost my medical entrance exam just because of 2 marks. This is a regular thing, because these 10-20 points are of techniques, are of what you do on that day and what you do regularly in terms of practicing. So this is very important, that you do one listening 2 times, again the most important thing. And even before exam, you must listen to something on that day. Do not execute answers, but keep your mind aware that the first exam that's going to come in your hand in the OET is your listening. So please be charged up for that exam. So now the possible condition.
that you're experiencing malabsorption. So what I need to do,
So
Being down,
the
is
word
that-
he has spoken is malabsorption. So I will try to check out
Normal?
that word.
frequent and large bowel movements, that does point to something that could be important. It appears that you're experiencing malabsorption. So what I need
Now, see, you can learn so many things. Again, I'm sorry, whatever I do, I want to do that in the best possible way. That is why I stop you again and again, because I want you all to notice small things rather than big things. Notice small things. Like possible means it seems, it appears. Appears means it's a possibility. So that is where you can correlate the words even in reading. Even when you do writing, when there is suspected diagnosis, you can also say that on the basis of these signs and symptoms, he seems to be a case of. When the patient is a suspected case of, you can also write he seems to be a case of. So seems means it's appearing. It is a possible condition. It is a suspected condition. So that is where you correlate the words if your vocabulary is good. So yeah, sorry for interrupting, but again, this is what I want to teach you. That is, I must tell you that how many things run in my mind. And that is what makes me so secure when I talk about listenings and readings, because I know how to correlate things. So that is what I want to teach you as well, being your mentor. Yeah, so I will do it again.
Nothing like that. I do sometimes have some issues in the bathroom, like I have a bowel movement like 3 times a day, and I don't know if that is normal. Also, sometimes it can be difficult to flush everything down. Is that normal?
frequent and large bowel movements, that does point to something that could be important. It appears that you're experiencing malabsorption. So what I need to do is order some investigations to find the cause. Let's go back a bit to family history.
So now when the person talks about family history, then it is certain that the word was malabsorption. Again spelling malabsorption, absorption. So that should be the spelling. Or malabsorption, absorption. Okay. So again, please, again, when I will do the answers, I will try to learn this spelling to make sure if something like this comes in my exam, then I should know the spellings. So that is why you should not be in hurry. And again, to listening 2 times. Again, I will keep on repeating this important instruction for you all. Okay, family history. Now I know this was mole absorption. Now go to the next.
Do you have any history of abdominal problems in your family?
Yes, I think so. My grandmother, the one who lived in Ireland, died 3 years ago, and I think she had some bowel problems. But to be honest, I don't know the specifics of her condition. So with the
Died. Now this is a tricky blank because none of the word is fitting. Died 3 years ago from Ireland. This blank is not nicely given. There should have been a full stop. So deceased grandmother died 3 years ago from Ireland. So that should be the answer. Let's see. I will try to, again, this is where I can learn. So I will, before checking the answer, I would like to listen to it again. So as to learn, because there were 2 words. One was 3 years ago, and there was another word she spoke, which I missed out, which I did not miss out, but now I have forgot. So I will play it again.
Yes, I think so. My grandmother, the one who lived in Ireland, died 3 years ago, and I think she had some bowel problems. But to be honest, I don't know the specifics of her condition.
So now I could have written died because of bowel movements, but these things are given here. Abdominal issues, no specific available. So this is what she is speaking here. So now it is almost certain that I have to fit 3 years ago, and there should be a full stop that they should have given. It's not my responsibility, but they should have given the full stop, or F should have been smaller. Died 3 years ago and from Ireland. I hope. Rest we will see again. I will keep on thinking because till the time I do not absorb, I do not learn. So patience is the key again.
So with the investigations, what would you actually be looking for?
Well, the first thing would be to see if your white cell count, hemoglobin, platelets, and the like are within normal ranges.
So blood cell count, hemoglobin and platelets. White blood cell given, platelet given. So most probably hemoglobin. So that is where you need to be aware. But still, I will keep the focus high because there can be other word. But up until now, it should be hemoglobin.
Anemia, which would be indicated by a low level of hemoglobin, is a common cause of tiredness. But of course, we would then still need to figure out the cause of it.
Sorry. We missed out on something. Yeah.
The specifics of her condition. So with the investigations, what would you actually be looking for?
Well, the first thing would be to see if your white cell count, hemoglobin, platelets, and the like are within normal ranges. Anemia, which would be indicated by a low level of hemoglobin, is a common cause of tiredness. But of course,
So
we
now
would.
this blank is tricky. To check hemoglobin, low levels, this is enough flow. To check hemoglobin level, low levels of hemoglobin may cause anemia. I will try to make you listen to it again.
The first thing would be to see if your white cell count, hemoglobin, platelets, and the like are within normal ranges. Anemia, which would be indicated by a low level of hemoglobin, is a common cause of tiredness. But of course.
So this is a tricky blank when in the exam you will have only one shot to listen to. So that is where you need to practice. Practice is everything, my dear. So let's go ahead.
You would then still need to figure out the cause of it.
And what are some of the common causes of malabsorption? What might we be looking at here?
Well, one possibility worth considering is celiac disease.
So celiac disease, C-E-L-I-A-C. Again, the word is possibility. So I hope this should be the answer because now this is going fast. So it is not a very easy listening because in exam you will get only one attempt. So it is not that easy a listening as it is appearing. First question, I am not sure. Second question, I don't know. I should have written only no or should have written does not smoke. Third question is correct. I think fourth question should be correct. Fifth question should be correct. Sixth question, again, mole absorption spelling can be trouble. Seventh question, 3 years ago, I am not sure. For next question, I am sure it should be hemoglobin level. Then hemoglobin spelling HAEMOGLOBIN. So all these things I should know. Then low levels may cause anemia, ANAEMIA. So this I should know. Some countries also write anemia as ANEMIA. So both will be considered correct. Then you are going to the next thing, possible diagnosis. So all of a sudden it has gone fast. So you need to keep the focus high. And you need to know about these things, that which blanks you have to fill. Like 10th, celiac disease, Ireland has dash more cases than rest of UK. Let's see.
Particularly since you mentioned that your Irish grandmother had some bowel problems. Celiac disease is 4 times more common in Ireland than in the rest of the UK.
Ireland has 4 times more. FOUR, or you can simply write numerically 4 times. Times should definitely come with S, times, because 4 times.
And there is a genetic component to this disease.
And would the results of the investigations be enough to diagnose me with celiac?
No, I'm afraid they would not be enough. Depending on the results of the investigations, we would then have to do an endoscopy and biopsy to confirm a diagnosis of celiac disease. Unfortunately, there is no simple blood test we can do.
Are there any other possible diagnoses?
Yes, but I would prefer to wait to talk about other possibilities until we have the results of the investigations. We can go ahead and take your blood today, and that way we would get the results back by Monday. Are you available for?
Again, this 12th question was not that easy, but the only thing I could remember is endoscopy. Endoscopy is the only word. So these are my answers. Now, if I am practicing, I would do this listening one more time. But today, because I am recording, so due to the lack of time, I have to see the answers so that we can learn. So I'm just going to the answers. So you can practice any listening any day. Fatigue, non-smoker should have been a better word. So this is what I have learned. Does not smoke, rather I should write non-smoker. I still would say no, do not smoke is, does not smoke is not wrong, but non-smoker is better word because it is fitting up with the rest of the words like regular, occasional. So non-smoker should have been a better word. So this is learning for me. Vegetarian correct, appetite correct, bowel movement correct, mole absorption P. I will remember the spelling P, the one I spoke earlier. P. 3 years ago, hemoglobin, HAE or HEMO, both are correct. Again, American and British both are correct. Anemia, I told you, both are acceptable, nothing to worry. Celiac disease, 4 times endoscopy. So almost all the questions are correct. But if by chance I do 3 or 4 spelling mistakes, then it takes me away from my goal. So that is where I always tell you that concentration is the most important thing. It is all about concentration. If we are doing one thing just for the sake of doing, it is not good. Rather than 4 modules in a day, do 3 modules in a day, but do them very nicely to learn good things. So that is very important. Check spellings, check grammar. Non-smoker word I learned, rest were pretty much correct in my case. So that is learning. This is how we do OET listening. This was part A. Now we will discuss about the part C, but again, recording should not be too large. So I'm going to break it into pieces. We'll put it on mute now. We'll end up this recording. This is Dr. Bhupesh from Dr. BKM Institutes. Please subscribe our channel and rest. And I will take your doubts. Then we will go to OET listening part C. Thank you.